Welcome to Dr. A's weekly Healthy Bastards Health Tip. Now this week is a bit tough for me. It's actually about STD'S, sexually transmitted diseases. Some people call it VD or venereal disease, or the uncouth call it the clap. For me, it's very embarrassing talking about this sort of stuff, all right? Now, sexually transmitted diseases are just an infection spread between two people who are having sex. Worldwide, the main ones are bacterial bugs, so that's syphilis, gonorrhea, chlamydia. Viral bugs like the wart virus, hepatitis C and D, and HIV. And a few sort of annoying bugs like crabs or thrush bugs. In New Zealand, the main one is chlamydia. You see a little bit of syphilis and gonorrhea, but not much. Chlamydia and warts. So let's start with chlamydia. Now, if a man gets chlamydia, most people will get symptoms, and that's pain with urinating or maybe a bit of a discharge from the end of your dick. And it's got to be treated soon because what it can do is actually spread to your nuts and even cause a prostate infection as well. It can get quite nasty. But a small percentage of men have no symptoms at all. In women, the problem with chlamydia is that the infection can sneak up through the womb and into the tubes, and most women get no symptoms at all. The lucky ones do, a bit of pain and vaginal discharge, but a lot don't. And what happens is they get this low-grade insidious infection, and it clogs up your tubes, and it can lead to infertility. In children, in newborn who's still inside mum's tummy, they can be infected by chlamydia as well. They can develop an eye infection or pneumonia when they're actually born. So that's got to be watched out for, and certainly midwives and obstetricians are looking for that. So chlamydia is the main sexual transmitted disease problem in New Zealand. There's also warts, penile and vulval warts. They're a real bugger, those ones, but just watch last week's YouTube on warts, and it's got a picture of a dick with warts on and how we deal with it. So, with sexually transmitted diseases, number one, if you are at any risk at all, you don't have to have symptoms, you've been involved having sex with someone who might be infected, go and get checked out with your GP or at the family planning or at the STD clinic. If you've got symptoms, well, make sure you get your ass down there. Otherwise, it's really important to promote condoms for prevention, all right? This condom here is for a small dick. There's ones for medium and for really big ones. But you've got to use condoms because they're very good at stopping not just the bacterial infections, but also the viral ones, the nasty ones, HIV, hepatitis B and C. See you next week, fellas, for Dr. A's weekly Healthy Bastards Health Tip.